Hello and welcome to 1 in 75. My name is Alicia and I am an ovarian cancer survivor. And I just wanted to share with you in these series of videos some of the things that I learned along the way in my journey, some things I would like to share so I could help others when they receive a cancer diagnosis. Today I want to talk about your first meeting with your oncologist. By now you've already received your diagnosis, whether that be through your primary care physician, an OBGYN, or even at the emergency room. Things are starting to come at you fast and furious, and one of the first things that are going to be lined up is you're going to be assigned an oncologist that's going to work with you to come up with a treatment plan. So just to prepare you for the day when you go to the oncology department, wherever that may be, it could be in a cancer center that is separate from your main hospital. It may be in the wing of your hospital. There are many different places, so just make sure that when you get the information from your doctor, whoever is scheduling your first appointment, make sure you find out the exact location of where that's going to be. Now, when you first get to the cancer center, of course, you're going to go to the front desk, sign in and everything. When I was going through my treatment, that was pre-pandemic. So if you're watching this now during a time when we have mask mandates, different protocols set in place at your cancer center, make sure you call ahead of time or find out ahead of time what those protocols are going to be so you can make sure that you are following the guidelines. Now, when you first get there, most likely you're going to have some blood work done. You may get the orders to have blood work done before you go to the cancer center, or there may be somebody right there that's able to go ahead and draw that blood and make sure that they have everything ready so when you go back to actually meet with your oncologist the first time, they have some baseline numbers to go off. So just be prepared that on that first visit, and of course every subsequent visit after that, you're going to be giving up a little bit of blood. We'll address that a little bit later on. So after you've checked in and you've had your blood work done, you'll be called to the back and you're going to have your height and your weight taken. And just to prepare you as you go through this process, you're probably going to see that scale really start coming down in numbers. Don't panic. Try not to focus too much attention on that. Your body is really going to go through a battle coming up. The chemotherapy can really make you lose weight rather quickly. We'll discuss that a little bit later on as well. So make sure when you go to your first appointment to meet your new oncologist, take someone with you. Take a trusted friend, family member, spouse, adult child. Take someone with you because this is a time where there's so much going through your brain. You can't possibly retain it all. You're going to think that you did everything you needed to do and asked all the questions you think you needed to ask. And then when you get in the car and you're halfway home, you're going to say, did the doctor say this or did they say that? And did I ask this question? Take someone with you so you have an extra set of eyes, an extra set of ears, and that support system because this can be a very scary first appointment. Also, I'd like to recommend take your phone with you, set it to record, and just set it on the table. Let your oncologist know, I'm going to be recording our appointment today, just the audio, just so that in case I have any questions or if I forget something, I can go back and refer to this recording. Your doctor should have absolutely no issue with that. It should be absolutely fine. Now, the very first appointment I went to, I didn't heed my own advice. I got so caught up in everything that I was being bombarded with, I didn't record anything. I did write things down. If you're more of a visual individual that likes to write and take notes, take a notepad with you, take a pen, write things down. Make sure you thoroughly understand your treatment plan. Don't be afraid to ask questions. This is your life you're dealing with. Make sure you have an oncologist that you feel comfortable with. This first visit with your oncologist should not be a wham bam in the door, out the door kind of an appointment. Your oncologist should take plenty of time with you to explain to you everything that they know up to this point about your diagnosis. My first appointment with my oncologist lasted an hour. Now, yours may not last an hour. It may only be 40 minutes. It may only be 30 minutes. But I assure you, this is not going to be a 5-10 minute and back out the door appointment for your first meeting with your oncologist. If you find that you're not feeling comfortable, if you feel that you're not getting the attention that you feel that you deserve, you can ask to be reassigned to another oncologist. This is very important. It is important that you have a good relationship with your oncologist. You have to know you can trust them, you can count on them, and that they are listening to you. Very, very important. My very first oncologist was wonderful. When she moved, I cried. My second oncologist, not so much. He wasn't worth a hill of beans. Very poor communication, no desire to relate to me. He was very dry, not personable at all, and I didn't feel that I could trust my life to this individual. So I will no longer be seeing that oncologist. I'm getting a new one. So make sure you know that you have the power to determine what you're doing in this journey. Now, more than likely, your oncologist will have all of your pathology reports. They will have all of your lab work. They're familiar with the type of cancer you've been diagnosed with, and they will have a plan set in place. Now, if you find that you have a diagnosis that might be a little bit abnormal, maybe one that isn't a cookie cutter case, it is okay to let that doctor know, I'd really like to have a second opinion before we put the treatment plan together to make sure that everybody's on the same page. Now, if you have a really good oncologist, that oncologist will have already taken that step for you. For instance, I was diagnosed with ovarian cancer, not knowing at the time that there are 40 subtypes of ovarian cancer, and I had one of the rarer ones. So rare that the cancer center where I was going to receive my treatment, where I was to meet my oncologist for the first time, she had never treated for this particular type of ovarian cancer. She knew this was not in her wheelhouse. She had already placed a call to the Mayo Clinic in Rochester, Minnesota. An appointment had already been scheduled for me. All of my labs and all of my CT scans, pathology reports, everything had already been sent to the Mayo Clinic. They worked hand in hand to make sure that the proper treatment plan was put together for me. Not saying that everybody needs to go to that extreme, but if you have a rare diagnosis, make sure you talk to your oncologist and see if that's something that you need. Of course, all of your vital statistics are going to be taken. In addition to your height and your weight, you'll have your blood pressure, your temperature, your heart rate, all of that will be done. But make sure you have a hands-on experience with your oncologist. Make sure they feel to make sure that your lymph nodes are not swollen. Make sure they listen to your lungs. Make sure that they really give you a once-over. If you happen to have a neurological cancer, make sure they do a neurological workup with you while you're there. If you have an abdominal cancer, make sure that they palpate your stomach, feel around, make sure everything is looking good. You really want to make sure that your doctor is being thorough. Other than that, that might just be the extent of your first visit. Now, some of you may learn about what your treatment plan is going to be, and you're just going to go right back to the treatment center and start right then and there. It's rare, but it could happen, so just prepare yourself for that. But more than likely, you're going to meet your oncologist, discuss your treatment plan. You'll probably be set up to meet with their PA, their physician's assistant, who will help with a lot of things. Your PA is going to be a great resource for some availability for you of different resources. So make sure you ask if they have a PA or a nurse navigator that you'll be working with. We'll discuss that a little bit further as well. But that's it. Your first appointment is pretty much out of the way. Oh, let me remind you this as well. When you check in at the treatment center, ask the medical professionals at the front desk if you have a specific location where you can park. Some places you have to park way out, and trust me, once you start your treatment, you're going to want parking closer. So ask them if they have designated parking for their cancer patients, and also see if you have a placard that you can put in the dash so that everybody knows that you're permitted to park there. That is a wonderful thing that our cancer center had. We were connected to the hospital. It was very nice that everybody for the rest of the hospital, they wouldn't park in that area. They knew it was designated just for the cancer center. So see if you can get one of those. So that's pretty much your first appointment with your oncologist. If you have any questions, if you have any experiences that you would like to share, comment down below. Let me know how that went for you. If you have anything else you would like to add about a first trip to your oncologist, put it in the comments below. I'll see if I can pick that up in a future video. It's always nice to hear what your experiences are. So for now, from 1 in 75, I'm Alicia, and I will talk to you again soon. Bye-bye.